everyone. Thank you so much for joining in. Today's topic of discussion is postpartum constipation, and we have with us Dr. Pavitra Malli. Um, she is a BMS doctor, and she's a certified nutritionist. So she would be talking more about it. Let me just add her in. Hi, hello everyone. Hi Ramya. Yeah, we're just waiting in for the speaker and Vidya to join. Hey, hello. Hello, Rupjeet Kaur. How are you doing? Yeah, we're just waiting for Dr. Pavitra to join and we're waiting for Vidya to join. Hello, Anju. Thank you so much for joining. Hey, Ramya. Lovely to have you. I'm just going to add Vidya. Hey, hi, Vidya. Looks like you're not able to join. Yeah, there it is.
Hello.
Hi, Vidya.
Hi.
How are you?
I don't know. I'm doing good. This Instagram, no, suddenly it freezes. Okay, it was giving me difficult time to just click.
I think even Dr. Pavitra is trying to join. Let me send you.
Yeah.
Okay, he's trying to.
Sure.
Yeah. Hi,
Hello.
Hi guys, how are you all doing?
we are good. How are you, Dr. Pavitra?
Good.
Good. Is the audio clear? Everything clear?
Yes, it looks.
Yes.
Yeah, maybe you can just come a little bit towards the
Closer?
camera. Yeah.
Yeah, sure.
Hi, Mishri. Hello. Yeah, I think a little more. Maybe you can
Yeah, we
set
can.
down your camera because there will be more kind of like comments coming down, so your face will be hidden below that.
Yeah, I'm totally thrilled to be a part of your show. You guys are doing amazing. Thanks for having me
Thank
in.
you so much. We are so happy you accepted
Yes.
the invite and you agreed to join.
Oh,
It's a
my
pleasure
pleasure.
having you on board with us. Thank you so much.
Yes.
So, yeah,
Yeah, Nilufar, I think you can get
yeah.
started.
Yeah, so I'll start off with my first question. So like the most common question we have from many new mothers coming to us is that they're suffering with postpartum constipation. So it looks like one of the most common issues during the postpartum period. So, like first we want to understand why is it so common? Like what causes postpartum constipation and why is it so common in new mothers?
Yeah. So before I'm entering into answering your question, I want to zoom in a bit and understand what's happening, the different changes that's happening during labor, even gestation, and also postpartum. So I'm an expert in nutrition and also naturopathic medicine. So from traditional medicine aspect, I'm going to answer this question. So all our bodies are made up of three doshas. You might have been familiar with that, right?
Yeah.
Vata, Pitta, and Kapha. So when these humors should be in certain equilibrium in all of our body for us to stay healthy. Okay, so this whole pregnancy, labor, it's a natural physiological process. Okay, so in this normal physiological process, what happens is there is an inclination or there is a predominance of increased vata in the body. Like when you say vata, it is air and space component put together. So when you talk about
Okay.
air, what are the properties of air? It is very light, it is very dry, okay? There are different seats of vata in our body. So the skin is a seat of Vata, the bones and joints are the seat of Vata, and the large intestine mainly is the seat of Vata. So, if you, interestingly, there is a special type of Vata called as the Apana Vayu, which works even in the pushing, the expulsion of the uterus. That's why the Vata is going higher. And even for the evacuation of the bowels also, we need this pushing, right? The motility, the peristalsis of the bowel should happen. Now you can correlate why there is increased Vata throughout the gestation. Even, sometimes the mothers in the second and third trimester also experience constipation, and the pushing and the strain throughout the labor. So that's how in the postpartum, because of the increased Vata, all the mothers commonly experience constipation. But there are so many measures we can prevent it.
Okay, thank you. Thank you so much for that
Okay.
insight, Dr. Pavitra. Yeah, that really helped.
And what could be the symptoms which we can look out for, maybe for early diagnosis? Let's not, I mean, so that they need not struggle a lot till they, it really is painful. So let's not wait for that last stage of pain and, sometimes even blood clots come out. So
See,
what are the early symptoms?
yeah. So anything related to postpartum, we have to again and again go back the gestation period, the labor period. I would even say going back to the pre-conception state, because like
Mm-hmm.
anatomically, when you see what happens is the growing uterus is putting so much pressure on the other organs that's there, maybe the pelvic
Right.
organs and even the abdominal organs. Now, when you see this, anatomically, when you see this is the uterus, in front of the uterus is the urinary bladder, behind the uterus, you have this rectum and the colon, and in front, again, the bone is there, symphysis pubis, and behind that, you have the coccyx. This is the arrangement anatomically. So the growing uterus, what happens is it's put a lot of pressure on the colon and the other organs around there. So, normally the tendency is there for, a lax of these, colon muscles. So what I would say is if somebody wants to, become pregnant and have a healthful journey throughout pregnancy, preconception is a very important state where you can work on all these muscles, like, the abdominal core muscles, the back muscles, then the pelvic muscles. The pelvic muscles is the only structure that is, supporting all these pelvic organs. So if all these organs are toned and functions very well, the blood supply is going there right, then the recovery or the toning up will be very easy during postpartum. So what precautions we could take is, if you have the feeling that you're evacuating but you're not completely evacuated, then you need to keep an eye on that. Even, throughout pregnancy, even the last trimester going towards the due date, we used to say do not have, big size portion size of meal, so that it's very hard, it becomes hard for digesting, and also leads to constipation, because there is a natural lax in the muscles and leads to the fecal stagnation. That is a natural thing. It is not a pathological thing, but don't wait like until you're giving a lot of pressure there, because in the normal delivery few might be having this episiotomy tears or stitches over there. So don't strain, and there are a lot of things. Sitz bath can be given, cold application can be given, oil massages can be given. So many things are there even to prevent it. I would say,
Okay.
instead of going for a laxative, what could be done through food, how we can improve our sleep, how we can keep us hydrated. All those things are going to help here.
Right.
Okay. Massage, you mean full
In the
body massage
postpartum.
or?
Yeah.
Very.
What we
Okay.
can do in the postpartum is, there's a whole regimen in the traditional medicine called as Sutika Paricharya. So initially, massage is like a passive exercise. So newborn mother is totally exhausted and drained, and she doesn't have energy to do the massage and activate these muscles, because throughout pregnancy what happens is the blood volume is increasing almost 50 to 60 percentage, so that the whole system, you have this edema, you have this bloating, you have this water retention. So naturally this itself increases 3 to 4 pounds. We have the heart to pump our blood, but for the circulatory, means for the lymphatic system, we do not have anything to pump. We say the calf muscles are the second heart, but these massages, it moves and it moves the lymphatic system and it frees the circulation. And it also, when the blood supply is, happening to all the organs optimally, that is when you can heal. Now, I said when the uterus is growing, it is putting pressure on the other organs. It also puts on the
Right.
pressure on the main vessels like the abdominal aorta. So what happens is the blood supply to the specific organs are not that good. That is also one of the reasons. So for rejuvenation and the healing should happen means the blood supply should be optimum. So massage helps in all these areas actually. It also helps us to soothe and calm down by pacifying this vata. So this whole postpartum period is, in the process of recovery, the body will also have a period of inflammation. So massage is
Mm-hmm.
anti-inflammatory. It soothes you down and it also calms you. It makes you sleep better. You will have sound sleep and all those things. So massage to the areas we give to the lower limbs, then pelvic region, lower abdomen, your breast, all these parts can be massaged.
But then, we need an
Okay.
expert who can do the massage because, doing the wrong massage will have some negative impact. Should we
So
consider?
in that case, if you do not have much knowledge about massage, what can we do is you can just heat an oil in the double boiling method and just gently rubbing the oil itself will pacify vata. So we are not looking for any specific technique here, just moving the blood, just abhyanga is just the application of oil, not necessarily any Ayurvedic kind of massages. If you have access to that, that's absolutely fine. But at least applying oil itself will soothe you. It will help in healing the episiotomy sutures. And, if somebody has gone for C-section, maybe they need to leave that area. Otherwise, it should be totally fine. As I said to you, the uterus in the postpartum period is trying to go into the involution, right? It's trying to contract. So otherwise, it is like an empty organ. Wherever there is emptiness, a vacuum is created. That is what is space, the quality
Right.
of vata. That's what we were talking, air and
Mm.
vata. The space is together is called as the vata. So wherever there is empty space or vacuum is there, through the anal openings, the air will try to go and inside. That's why in South, they ask us to cross the legs at the ankle. Even the grannies in a
Yeah.
house, they will sit down and they cross their legs at the ankle. They sit like that because the vata cannot, or the air cannot enter through the anal passages. And if you see, they ask to close your ears with the cotton buds, cover your head to keep warm, because all these openings through where the air can enter and activate the vata. So the properties of, like, a disturbed mind, like, anxiety, depression, fear, are also expression of vata in the body.
Okay,
Okay.
one question here, massage. Okay, when we're doing the massage by ourselves, say for example, we do not find an expert, or even if we are asking somebody we know, maybe our sister or a friend or some helper in the house who can, or our husband, okay, to do the massage. What is the kind of pressure that we are looking at over here, and
I
what is
wouldn't, yeah. If someone is not an expert, we do not look for any pressure, or any pain shouldn't be caused. Just gentle application. Imagine now this is my lower limb. What I would do is I would go towards the heart, move upwards. If you
okay?
find any joints coming
Okay.
along, just rub the joints. Gently rub the joints. Then for the wrist, it's like this simple, gentle massage. Then, different variations you can give to your ankle, you can give to your knee joints, and work upwards. That's the
Okay,
simple logic.
okay,
Okay. Okay. Yeah, when I was during my postpartum period, I remember everybody used to come, cross your leg, cross your leg.
Yeah.
I was just recalling that, yeah.
Yeah.
So, what kind of, yeah, Pavitra, what kind of food can we include? I mean, yes, these massages and lifestyle changes and, strengthening core muscles will help. But other than this, food is also very important.
Yeah.
So,
Yeah.
What do you suggest?
Yeah, food is a very important thing during this postpartum period. So our acharyas, what they have done is in Sutika Paricharya, at least first 3 to 6 days, there is little restrictive diet based on what I said now. Then after 3 to 6 days, we would say 30 to 40 days, they will just transition into whatever they were eating before. And even the period extends like until they get their periods back. This whole period is called the
Okay.
postpartum period. So initially what I said, as the vata is vitiated, what happens, that's like a ringmaster. Now this then impacts on the other two doshas, that's a pitta and kapha dosha. So usually when the vata
Mhm.
is little higher, what it does is it impairs our digestion. So mostly you will have burping, bloating, constipation, digestion means indigestion. You will be hungry, but you will not be able to eat much. Then again, in a short while, you will feel hungry again. All these
Right.
disturbances will be there. So this whole Sutika Paricharya is based on pacifying your vata, improving your digestion. So what we say is the choosing of the herbs or the spices or the food should be based on simple and easy digestion. So this whole regimen varies in different parts of India according to their own familial practices. It varies. So in South, what we do is even in the ninth month, even before labor, what they used to do is they add a lot of herbs, then garlic, then sesame oil, jaggery, and then make it into balls. They cook it in a certain way and make it into balls. This will be ready even before birth of the
Right.
newborn. Okay, they
Okay.
have to take this like after every single meal. So if you they will avoid certain meals, like milk will not be given, all heavy to digest food, coconut will not be given, no deep fried foods, no food from outside, no old foods, no green leafy vegetables, not much of fruits will be given, because the digestion is yet not ready to handle all these things. Like when we look at lunch, we use certain herbs like black pepper, long pepper. In Tamil, something we called as kandantipili, means that is the root part
Okay.
of this long pepper. So these, and then sadakuppai, it is called as dill seeds. We make a soup or rasam out of that with the rice, and then we make a hummus kind of thing with garlic and this roasted Bengal gram. That will be the typical lunch for at least a week, 4 days to 7 days. So after the meal, what they will be given, newborn mothers will be given, is this betel nuts and betel leaf is a must from the day one.
Mhm.
And after lunch, then the buttermilk is given. Maybe milk is not given, yogurt is not given, buttermilk is given with hing, with again the tipili or the long pepper. There are a lot of fennel used to be used, fennel tea or jeera tea or dry ginger. So when you look at these herbs, all these herbs are antipyretic, anti-analgesic, because the pain is there. That is the postpartum period is more prone. We are vulnerable to infections when the antibiotics was not yet there in the earlier days I'm talking
Mhm.
about. So people were using all these kind of herbs where it was analgesic, antipyretic. As I said, in the recovery process, there's kind of inflammation. So these are anti-inflammatory. Then look at Shatavari. No, it prepares
Yeah.
Mhm.
the milk secretion. It also helps in
Okay.
rejuvenating the reproductive system or the reproductive organs. It helps in the metabolism of your blood glucose and also your fats, that is taken care. There are so many things. It helps you to calm down. It helps you to sleep well. It is anti-inflammatory. It helps in works in your sex hormones. So Shatavari, a teaspoon can be taken with ghee, or with honey, or with warm milk, or you can mix everything and take it. These were the different regimens that were strictly followed. And after every single meal, that ball should be taken. Even people start taking this even in the last trimester also. They literally give it almost for a year. We need to take it. So it is good for the digestion of the baby also. We're not directly introducing anything to the baby, but through our milk, all the nutrition, everything is going to the baby. That's the wonder of our ancient wisdom. Then slowly they transition into the normal food. Like they can include a lot of green leafy vegetables, different kind of colorful vegetables in their plate. And we need to increase the fiber to
Right.
is
Mhm.
I think there is little bit lag. Can you hear me properly?
Now it's
Yes,
fine.
Yeah.
yes.
Okay. So when we say address in the context of constipation, postpartum constipation, we should have at least 25 to 30 grams of fiber. So fiber can be taken in the form of fruits, vegetables, dry fruits, nuts and seeds are awesome during this period. Then whole grains. Now, when we are away from all these things. Whole grains, it's just coming back again. We can take cracked wheat